Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. London Therapist. We offer a range of individual therapy services including Cognitive-Behavioural Therapy, Dialectical Behaviour Therapy, emotion-focused therapy and mindfulness and acceptance-based treatments. Our individual therapy is focused upon addressing the problems in your life most affecting your quality of life, including problems related to mood, anxiety, substance use, anger, impulsivity, among a range of other concerns. We have London therapists who also have additional expertise in dealing with more severe problems such as suicidal ideation, trauma, and self-harm. These one-on-one sessions occur for approximately 50 minutes per week, with the length of the treatment dependent on your individual needs. Cognitive Behavioural Therapy, or CBT, is a type of psychological treatment used to help people with a variety of different mental health problems. CBT is based on the idea that psychological difficulties often result from the interplay of thinking patterns, emotions, actions, and situations. Learning CBT from a London therapist can give you a greater insight into the types of thought patterns that generate your depressive, anxious, angry, or many other problematic and distressing emotions and reactions that are having a significant impact on your life. Research has suggested that CBT with a London therapist should be considered the first line of treatment for depressive and anxiety disorders. It is the most effective. CBT will target the hopeless and negativity thoughts in depression, the helpless and catastrophic thoughts that trigger anxiety, and overall, the types of thoughts that negatively impact a person's mental health. CBT involves learning to identify problematic patterns of thinking, emotions, and actions, and to change behaviours and develop new coping skills. CBT is particularly effective for depression, anxiety disorders, problems with anger, and general stress. There is also evidence that CBT is helpful for people struggling with substance use problems, symptoms of psychosis, chronic pain, and other problems. Dialectical Behaviour Therapy, or DBT, is an evidence-based treatment. Originally, this treatment was designed for individuals who were in frequent crisis, suicidal, and struggled with coping with their day-to-day life. DBT has been validated for a variety of disorders such as PTSD, depression, anxiety, addictions, eating disorders, mood disorders, impulse control disorders, personality disorders, and for those with other self-injurious behaviours. The main goal of this treatment is to assist people in improving their quality of life. DBT works best when you participate in both group and individual training skills. You will learn new skills to help you learn to better identify and cope with your emotions, better tolerate distress, and learn more effective ways of communicating in a skill-based training course. In individual therapy, you will focus on reducing or stopping problematic behaviours that interfere with achieving your goals, address crisis, and learn how to tailor the DBT skills to your needs. Between session skills, coaching is also available with your individual London therapist. Emotion-focused therapy, or EFT, is an empirically supported treatment that addresses challenges that can arise when an individual's reaction to and processing of emotion has become problematic, in turn causes challenges to the mental health and quality of life. This therapy focuses on an individual becoming more aware of her or his emotional experience and better able to process and experience emotions adaptively, rather than avoiding or otherwise experiencing emotions in a way that lead to maladaptive responses. With an evidence base in areas such as grief, depression, and anxiety, this modality facilitates a stronger and healthier connection to the experience of emotion, with individual sessions having a focus upon moving from emotions routinely causing distress to there being an integrated aspect of the person's sense of self and resilience. Whichever London therapist you choose, they'll be there to talk through any of your issues. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast, which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course, when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.